Okay, so let's talk about tuberculosis. Before we can get into some of the drugs and the things that we do to treat tuberculosis, you really got to understand and fully understand the difference between latent tuberculosis, latent TB, and active TB. The good news is that we treat far more cases in the United States of latent TB, so therefore we have very reduced cases of active tuberculosis. The other news is that even though we do lots of TB screenings for pre-employment purposes and so forth, we still do see cases of active tuberculosis, and these cases do expose numbers of people each year in the United States. First, latent tuberculosis, or what is also known as TB infection. This is when the person has a positive skin test, and a reaction on their skin test which is greater than 5 millimeters. That would be considered a positive reaction. They have a negative chest x-ray where we don't see anything on their chest x-ray, and they are asymptomatic, meaning they don't have any hemoptysis, no cough, no night sweats, none of those problems like that, no complaints of those problems. So when the person is diagnosed with having what is called latent TB or TB infection, the first line drug for that person is going to be INH, isoniazid. It is still the most common drug used in the treatment of tuberculosis, both latent and active tuberculosis. It is very, very inexpensive because it's been around a long time, and it still does definitely the best job for treatment of TB. We usually also use pyridoxine. Pyridoxine is just B6 because we know that when a person is taking INH, their body becomes, there's a reduction in the B6 in the body. So their body becomes somewhat depleted of B6, vitamin B6. And so we give them that, the B6, the pyridoxine. Things to remember about for your patient when you are starting them on these tuberculosis medications. The first thing is that we monitor liver enzymes before taking INH, and while the person is on INH, at least once a month, they're going to be going to the doctor or to the health department near them and getting their liver enzymes done. We also want to encourage them not to use any alcohol while they're on these medications, because that also is going to affect the liver and can cause them problems and maybe even have to stop the medication. We do encourage the person to report to us any nausea, vomiting, any yellowing of the skin, which would indicate liver issues, fever, and those sorts of things. The other thing that you need to keep in mind, this person must take their medication each and every day until the treatment is complete. It is very important. We do know that certain cases of MDR, multi-drug resistant tuberculosis, active TB I'm talking about, can come from a person that had latent TB and really did not take their medication for the latent TB, and then later in life they end up developing a case of active tuberculosis, and at that time they're no longer sensitive to those first line drugs, so it can become quite a problem for treating that person. All right, on to active tuberculosis, or also what is known as TB disease. This person has a positive PPD. They also have a positive chest x-ray where we can actually visualize on the chest x-ray TB disease, and they also have positive sputum specimens. They have symptoms usually, the symptoms of tuberculosis, hopefully you remember those, but hemoptysis, night sweats, there's lots of problems, fatigue. Of course, everybody has fatigue, right? But that person is going to be symptomatic. The education that we need to really stress for this person, because this person is infectious, is the fact that they need to really limit their exposure to other persons. Until this person has negative sputums, we usually kind of quarantine them to their home environment. Some of them may even actually be in the hospital when they're being treated. The other thing is the TB mask, and you know that this TB mask is a thicker mask, a different mask than just a regular surgical mask. So you have to educate your patient on that. Most of these people are going to be on DOT, directly observed therapy. And if you don't know what that is when the health department usually is in charge of this, they actually will go out to the person's home and watch them actually swallow their medication every day.
time that they are being treated. We have employed with the Department of Health in Virginia a position that is called a EpiRep. And the EpiReps, that's a big part of what they do, is they go out and they assure that these people are taking their medications throughout the entire treatment time. It is that serious that we want to make sure that that they're taking their medicines and that the treatment is complete. The drugs for the active tuberculosis, again, INH, still the first line of choice. Usually going to be on that about 6 to 9 months. And then we have rifampin. Again, 6 to 9 months going to be on that medication. Rifampin has a kind of a special thing you need to remember about it. This one will turn the patient's urine, their saliva, their tears, all of those things that will turn them orange. So you need to be sure that you tell your patient about this, because you don't want them to get excited when they see this happen and not know what it is, maybe end up back in the emergency room somewhere. That wouldn't be good. So do warn them and tell them about that side effect. There are currently about 10 different medications that are on the market that are FDA approved for the treatment of tuberculosis. A side note is that the CDC down in Georgia, federal agency, is the #1 resource for tuberculosis information as well as TB drug information. And you don't really need to know all of those first line drugs, but the drugs that you do need to be familiar with, you need to be familiar with INH, of course, rifampin that I've already mentioned, streptomycin, ethambutol, and pyrazinamide. Those are probably the top 5 medications that are used for the treatment of tuberculosis, whether it be latent or active tuberculosis. Things to remember about the streptomycin: that is the one that we want to make sure that we're doing a hearing test on the person, because it can interfere. Use of that medication we know can cause hearing difficulties. Ethambutol, that one we want to do eye exams for this person, because we know it also can affect their vision. Again, I want to mention about the directly observed therapy. They're usually on that at least until they have negative sputums. And then again, most persons will be on that probably the entire treatment, unless they just really impress upon the health department that they are compliant. Sometimes they may go to twice a week treatments, that sort of thing, to be able to keep these people in compliance with their drug regime. Let's see, what else did I want to mention? Oh, the bacterium, the actual TB bacterium. Just, it's a good note for you to know that, this bacterium can easily become multi-drug resistant. So we are really serious about the treatment of these persons and getting them into treatment quickly, because if this bacterium becomes multi-drug resistant, it can become very, very difficult to treat, and the patient may have to be on multiple drugs. They may be on IV medication for up to a period of 2 years to get successful treatment and cure of the tuberculosis. Until next time, see you.